So this is video 2 in the series of 6 videos for discussion on the trans-theoretical model of behavior change. The first stage of the model is called pre-contemplation. So people in this stage are not even thinking about changing yet. They may not even realize or acknowledge that they have a behavior that needs to be changed. These people are not thinking about change, and they definitely are not interested in any help. They may even defend their current behavior or not feel as if it is a problem at all. If someone tries to talk to them about their problem behavior, they may get defensive or shut down. They may tune out, they may change the subject. These people tend to avoid conversation altogether about the problem behavior. It's also possible that people in this stage may have attempted to change the behavior previously and may have progressed through the stages and ended up relapsing and are now in the pre-contemplation stage again, where they've returned to the bad behavior and again are in denial, don't want to change, don't think they need to. Weighing pros and cons is an important aspect of this model. So in this stage, they aren't really explicitly weighing the pros or the cons, but more on a subconscious level, the cons are far outweighing the pros at this point. But then as people move through these stages, they become more balanced, and then by the time they get to that 5th stage, which is maintenance, the pros are definitely far outweighing the cons by then. So here again, not even thinking about change, not explicitly weighing the pros and cons, but definitely subconsciously the cons of changing far outweigh the pros. So in regards to physical therapy, as an example, people in the pre-contemplation stage are not yet coming to physical therapy. So they're not people that are in our clinic in regards to physical therapy. There may be people that we're seeing now that want to make a change to start exercising more, or that need to start exercising more but haven't really thought about it. So they could be considered pre-contemplation also. But as far as physical therapy, an example of people in this stage are those that are not going to physical therapy yet. They may be suffering from chronic knee or back pain and think that it's just something that they have to deal with. They may not know that by not addressing it is the problem behavior. And so they might be in the mindset that they just have to live with it. And they don't know that physical therapy can help them. So these people have not yet sought our services or gone to a doctor to see what's going on. So what can we do to help them reach the next stage, which is contemplation? So first of all, we want to encourage self-exploration and evaluation of the behavior. And so this would be more for our patients that are already in here but want to adopt a new behavior of either eating healthier or working out, something like that. So we want to encourage self-exploration and evaluation of the behavior. So this could be as simple as asking them, if you could change one bad habit, what would it be? And so that kind of goes along with that motivational interviewing, by just asking the questions to make them realize that there's something they need to change. So by getting them to think about, what's something that I do that I want to change? What bad habit do I have? That might make them realize, maybe I spend a lot of time sitting on the couch watching TV, or maybe I need to be more active. Maybe I need to change my eating. And so really just encouraging that self-exploration is a way that we can help them get to that contemplation stage where now they realize, okay, maybe I should change something. So we also want to explain and personalize the risk of not changing. So for example, we have a lot of patients with osteoarthritis or chronic back pain that may be exacerbated because of their excessive weight, because of obesity, or even patients that have already had joint replacements due to the severe osteoarthritis. So we want to educate them, and we know that stress equals force divided by area. So when people are carrying this excess weight on their bodies, it's creating increased stress on their knees. So just by verbalizing and emphasizing the importance of weight loss to reduce stress on the knees and the back can be enough to help them think, oh yeah, maybe I should do something, maybe I should change. And of course, by the time they see us, I'm sure their doctors and other people have already told them that they need to lose weight, but it's just helpful for us to further encourage that thought process. The more people that tell them, the more they start to realize, yeah, I need to change, I need to do something. So just making them realize that can help them move to the contemplation stage. And sometimes encouraging self-exploration and explaining the risks are enough to propel them to that stage, but sometimes something dramatic has to happen, such as getting a scary test result back, or having a death in the family due to similar behaviors, or maybe now that they've had to have one knee replacement done, they want to avoid having the other one done. Maybe that's enough now to get them to exercise more, to lose weight, to adopt a healthier lifestyle. And we just need to be there to help reiterate the importance of that. And so the next video will be on contemplation stage. Thanks.